Hey Future Medics, Tina here, your medic mentor, and today we're going over one of the OGs of medicine, morphine. You will see this one used, and we'll see it in trauma care, for chest pain, and to treat pain with burns. Now there's no fancy names that we have to remember here, it's just morphine sulfate. And this is an opioid analgesic. So it's going to bind to the opioid receptors in the brain and the spinal cord to block the perception of pain, calming our patient and allowing us to do what we need to do. You'll also see this one used in chest pain because it has mild vasodilatory effects that can reduce preload and thus reduce chest pain. The typical adult dose is 2 to 10 milligrams, and that can be given IV, IO, IM, or even IN, intranasally, IN. I don't think we've seen that one yet. So the onset is about 10 minutes and it lasts 2 to 4 hours. But here's something you need to know. This will drop your patient's blood pressure for 2 reasons specifically. Remember earlier we talked about vasodilatory effects. So the vessels are dilating and getting bigger. The container is bigger, thus the pressure drops. Yeah? Cool. So we opened up the container, and so that blood pressure is going to decrease. The other reason is when people are in pain, their blood pressure increases. And now that we have controlled that pain, they're going to relax more, and the blood pressure is also going to go down. So keep a really close eye on their vitals and make sure that you're taking another blood pressure right before you're about to do another dose of this to make sure it's still safe to give. Another thing you need to watch for with this is it is a CNS depressant. So your patient is going to be very relaxed and they might stop breathing, which is problematic, tends to be. Keep a very close eye on them and they'll be okay. Common side effects include hypotension, nausea, vomiting, and respiratory depression. We already talked about respiratory depression, you've got it. Nausea and vomiting. This one is well known for causing nausea and vomiting. So much so that people often just go ahead and give Zofran. If you're going to give morphine, if they can have it, they're not allergic to it, don't have any problems or contraindications for Zofran, give Zofran. Just give them together. They're best friends. And you will be your patient's best friend if they don't throw up everywhere. So super well known for causing nausea, vomiting. Be aware of that, especially if your patient is backboarded and can't turn to throw up. Yeah? You got it. Okay. Contraindications. Hypotension. CNS depression, respiratory depression, head injuries, known hypersensitivity. We talked about hypotension. We talked about why this happens and what's going on that causes it. If you already have a hypotensive patient and you give them morphine, they're going to become even more hypotensive, thus becoming an even more critical patient and scaring you in the process. None of us think well when we're scared. So often you'll see a minimum systolic blood pressure to give this medication, and it's usually around 90 to 100 millimeters of mercury. So always keep a really close eye on that blood pressure before you're going to give another dose or your first dose, what have you. Make sure you take that blood pressure right then to know what the pressure is right now before you give this. Yeah? Wonderful. Being an opioid, of course, Narcan can be given to reverse the effects of morphine. So remember that, keep it in mind. If things go sideways, reverse it, take it away. But always keep a really close eye on your patient and be prepared for what might happen so you know what to do when it does. Now here's your takeaway. Morphine is a powerful medication and you're absolutely allowed to give it, but you better know what it does and you better be ready to deal with it. Keep your patient safe, keep their airway safe, and everything will be fine. You're doing so great with this series. I'll see you for the next one.